Welcome back to West Texas View.
Ravi Patel, one of our third year student doctors, is talking to us about how he was able to go to medical school. And before the break, Ravi told us that he was from a lower income family who had immigrated to the United States but worked hard and were willing to sacrifice, but they also were giving him encouragement to use those God-given brains that he had, and he was willing to work hard. But you were saying just before the break that a lot of the students that you went to school with didn't even graduate from high school, much less go on to college.
Mm-hmm. So in San Angelo, there are 2 high schools. And the city, as far as elementary grade school wise, it's pretty spread out. Where I went to elementary, like as you were mentioning, most of those students did not graduate high school, and only a few went to college, and only a few, I'm probably the only one that
went to medical school.
Went to a postgraduate profession. And the school system has gotten a lot better. They've gotten, they've been more aggressive about
trying to help.
About, bringing in college, basketball players, and, sports is a great outlet for students to identify with and be able to find a scholarship, go to college. They've, been pushing academics more competitions, things like that, where students are getting more involved. They've made a huge effort. But what helped me the most was when I got to college, my parents barely had enough to make it by, so I was on mostly academic scholarships, but I joined a need-based program to make you jump through a bunch of hoops freshman year. It's called the Joint Admissions Medical Program.
Joint Admissions Medical Program.
And in short, we can call it JAMP.
Okay.
JAMP. So in 2003, the Texas legislature came up with this program to help highly qualified, financially disadvantaged students pursue a medical education. These students don't have a lot of the opportunities and support they need to get to medical school because it is a difficult process applying to medical school.
And you can't work because you're working at school all the time.
Exactly. And there's a lot of hoops you have to jump through and a lot of things you need to do to be able to go to medical school. And they are great. It's a tremendous opportunity that they provide for us financially disadvantaged students to be able to.
So it's primarily a financial aid program that follows you through your medical school.
Yes. So sophomore year in college, we apply to this program. They take about 100 students a year. I'm not exactly sure on the statistics of how many students actually apply, but they take the most qualified students. They make sure on FAFSA they are need-based, so they're not just taking advantage of the program.
Right.
And not only do they provide scholarships for financial support, they also provide 2 summer internships at 2 different medical schools. So between your sophomore and junior year after you're selected, and between your junior and senior year, where they help you prepare for interviews for medical school. You get to shadow physicians. You get to take part in an MCAT class, which MCAT's probably the most difficult exam I've taken in my life.
Right.
Even after taking my first board exam in medical school, MCAT was still probably the most difficult to me. And they provide all these educational opportunities and exposure to medicine that you would not have gotten otherwise.
And it helps to solidify, this is what I really want to do. And this is what I'm willing to work hard at. And that's what they want to do in that program. They don't want to waste their time and money if you're not really dedicated. Exactly.
And that program actually solidified my interest in medicine. I initially wanted to go to medical school because my senior year, towards the end of my senior year, I actually had a knee injury. I was really involved in sports, and I had a knee injury, which I was not able to continue sports for the rest of the year. I, jumped around from a few different orthopedic surgeons, and I had to go get my knee looked at several times, and I was finally with physical therapy and the necessary surgery, I was able to get back into sports, and it felt like a big part of my life was returned to me, since sports was a big part of my life. And I wanted to be able to provide that same feeling back and give it back to people who are also, in the same position I was. But when I finally got to the Joint Admissions Medical Program, they, working with patients and working, just seeing medical students, and, how grateful they were to be in medical school. And it's such a great privilege to be able to, take care of people, like I mentioned before. It's just solidified my interest.
And aren't you pleased that we have that program? Because you could have probably done it through some of the other loans and grants and things, but this is just going to make it that much easier for you to find your way through medical school. And that's something I wanted to point out, is that it's not the only way. So if you choose to apply for the program and you don't get accepted, it's only a minority of the students in Texas are through that program. But you certainly need to try for it.
It's a great opportunity, but there are so many other different programs, and there's the traditional route of getting into medical school, which it's a little more difficult if you don't have that financial support, but it's definitely worth looking into.
And the best way to do that is to go to your financial aids officer of a college and ask for the JAMP program. Say the name of it again.
Joint Admissions Medical Program. And you can go to the head health professions advisor, and they have pamphlets, usually a representative from you can look it up online. There's a website for it. They have pamphlets at schools. They usually come give talks about it, and they do high school outreach programs. They come to universities to talk about it. Health profession seminars. There's a lot that goes on with this program.
And for years they've had the NIH funding program for medical students, but those are mostly loans. We're going to take another break, and we'll be back and finish this conversation in just a minute.
Stay tuned. West Texas View will be right back.